You've probably heard all the advice about controlling blood sugar, taking your medications on time, and cutting back on sugar. But did you know there's a hidden factor that can make managing diabetes much easier? And it's something that most people overlook? That's right, we're talking about vitamins. In today's video, I'll be revealing 3 essential vitamins that are crucial for people with diabetes to manage their health better, but are often ignored. Stay tuned, because this could change the way you approach diabetes care. Hello, and welcome to the channel. If you or a loved one has diabetes, you've likely heard all sorts of tips on how to keep your blood sugar in check. But there's one important aspect that doesn't always get the attention it deserves: vitamins. While we often focus on medications, blood sugar levels, and diet, vitamins play a vital role in diabetes management too. In this video, I'll share with you 3 powerful vitamins that can make a huge difference in how well you manage diabetes. Let's dive in. 1. Vitamin B6. When you think about vitamins, the first ones that probably come to mind are vitamin C, D, or maybe even vitamin A. But there's one vitamin that's often overlooked, even though it's essential for managing diabetes: vitamin B6. This vitamin plays a crucial role in nerve function, energy production, and glucose metabolism, and it's especially important for people with diabetes. If you have diabetes, chances are you're not getting enough of it. Why vitamin B6 is important for diabetes? Vitamin B6 is essential for the production of neurotransmitters, which are chemicals that help regulate mood, energy, and nerve function. It also plays a key role in breaking down glycogen, the stored form of glucose, helping release energy steadily rather than having spikes or crashes. For people with diabetes, high blood sugar levels can cause the body to lose vitamin B6 more quickly. Your kidneys expel excess glucose, but along with it, important nutrients like vitamin B6 are flushed out as well. Additionally, high insulin levels can interfere with your body's ability to metabolize vitamin B6 effectively. A deficiency in vitamin B6 can manifest in a variety of ways. The first signs of low vitamin B6 levels are often fatigue, brain fog, and mood swings. These are common symptoms of diabetes that many people experience, but they can also be a sign that you are not getting enough of this essential nutrient. However, the most concerning symptom of B6 deficiency is nerve damage, which can show up as tingling, burning sensations, or numbness in your hands and feet. If left untreated, the damage to your nerves can become more severe, leading to poor coordination, muscle weakness, and even permanent nerve damage. The role of vitamin B6 in nerve health is especially critical for people with diabetes, as they are more likely to experience diabetic neuropathy, nerve damage caused by high blood sugar levels. Without adequate vitamin B6, nerve function can decline, leading to a host of uncomfortable and potentially dangerous symptoms. Let's take the example of Sarah, a 45-year-old woman with type 2 diabetes. Sarah had been managing her condition for years by monitoring her blood sugar levels and taking her prescribed medications. However, she began experiencing persistent fatigue, brain fog, and numbness in her hands and feet. At first, she thought it was just part of getting older, but when the symptoms worsened, she consulted her doctor. It turned out that Sarah had a vitamin B6 deficiency, which was contributing to her nerve damage and overall fatigue. Once she started incorporating B6-rich foods like chickpeas and salmon into her diet and took a B6 supplement, her symptoms improved significantly. She regained energy, and the tingling in her feet subsided. To make sure you're getting enough vitamin B6, you need to incorporate more vitamin B6-rich foods into your diet. Some of the best sources of vitamin B6 include chickpeas. Just 1 cup of cooked chickpeas provides about 55% of your daily vitamin B6 needs. Beef liver, known as one of the most nutrient-dense foods, a 100-gram serving of beef liver offers around 50% of your daily needs. Salmon. This fatty fish is not only rich in omega-3 fatty acids, but also provides about 40% of your vitamin B6 intake per 100 grams. If you're not able to get enough vitamin B6 from food alone, supplements can be an option, but always consult with your doctor before starting any new supplement regimen. 2. Vitamin E. Now let's talk about another crucial vitamin, vitamin E. Often associated with skincare for its anti-aging properties, vitamin E is also a powerful antioxidant that plays a vital role in protecting your body from oxidative stress. Oxidative stress is the damage caused by free radicals, unstable molecules that can damage your cells. For people with diabetes, high blood sugar levels increase oxidative stress, making it even more important to have adequate vitamin E to protect your cells, nerves, and blood vessels. Why vitamin E matters for diabetes. When blood sugar levels are consistently high, the body experiences more oxidative stress. Free radicals can damage cells, tissues, and organs, which speeds up the aging process and can lead to complications such as heart disease, nerve damage, and kidney disease. Vitamin E is a powerful antioxidant that helps neutralize these free radicals, preventing them from causing damage to your cells. Without enough vitamin E, your body's ability to fight off this damage is reduced, making it harder to manage diabetes and increasing the risk of complications. A deficiency in vitamin E can lead to several health problems, particularly affecting the nervous system. When you don't have enough vitamin E, your nerve cells become more vulnerable to damage, which can worsen diabetic neuropathy. Symptoms may include numbness, tingling, burning sensations, and muscle weakness. Vitamin E is also crucial for maintaining healthy blood vessels, so a deficiency can contribute to poor circulation, which can increase your risk of cardiovascular disease and diabetic retinopathy, damage to the blood vessels in the retina. If left untreated, a vitamin E deficiency can result in more severe complications. For instance, your immune system may weaken, leaving you more susceptible to infections. Muscle weakness and poor coordination can also occur, making everyday tasks more difficult. Vitamin E deficiency can even affect skin health, making your skin more prone to dryness, irritation, and slower healing of wounds. Consider the case of John, a 60-year-old man with long-standing type 1 diabetes. John had been struggling with diabetic neuropathy, experiencing numbness and burning sensations in his feet. Despite taking his medication as prescribed, he was not seeing much improvement. When his doctor ran tests, it was revealed that John had very low levels of vitamin E in his body. He was also experiencing muscle weakness and dry skin, which are common signs of vitamin E deficiency. After John started including more vitamin E-rich foods like almonds and sunflower seeds in his diet and took a vitamin E supplement, he noticed a marked improvement in his neuropathy symptoms. His skin became less dry, and he had more energy. Vitamin E is found in a variety of foods, so it's easy to include in your diet. Some of the best sources of vitamin E include sunflower seeds. 1 ounce of sunflower seeds provides about 66% of your daily vitamin E needs. Almonds, a great snack that offers around 48% of your daily requirements per ounce. Spinach. A cup of cooked spinach delivers about 20% of your daily intake of vitamin E. If you're not getting enough vitamin E from food alone, you can also consider supplements. But as always, it's important to check with your doctor before starting any new supplement regimen. 3. Vitamin C. Finally, let's talk about vitamin C. Vitamin C is probably best known for its role in boosting the immune system and helping to fight off infections, but it also plays an important role in diabetes management. High blood sugar levels increase oxidative stress and can interfere with the body's ability to absorb vitamin C, making people with diabetes more likely to suffer from a deficiency. Without enough vitamin C, your immune system is weakened, and your ability to heal wounds slows down, both of which can be problematic for people with diabetes. Why vitamin C is crucial for diabetes. Vitamin C is essential for collagen production, which is necessary for wound healing. Since people with diabetes often experience slower wound healing due to high blood sugar levels, vitamin C can help speed up the recovery process. In addition to promoting healing, vitamin C helps protect blood vessels and tissues by neutralizing free radicals and reducing inflammation. For diabetics, this is important because inflammation and oxidative damage can lead to complications such as cardiovascular disease and diabetic retinopathy. When you don't have enough vitamin C, your immune system is weakened, which increases your risk of infections. Cuts and bruises may take longer to heal, and you may experience frequent colds or other illnesses. A deficiency in vitamin C can also cause skin problems, such as dry, irritated skin, and in more severe cases, it can lead to scurvy. an illness that causes fatigue, bleeding gums, and joint pain. For diabetics, a vitamin C deficiency can exacerbate complications such as kidney disease, heart disease, and diabetic retinopathy. Let's look at Maria, a 50-year-old woman with type 2 diabetes. Maria had always managed her blood sugar relatively well, but in the last few months, she noticed her cuts were taking much longer to heal, and she was catching colds more frequently. Her doctor ran some tests and found that Maria had low levels of vitamin C. The deficiency was making her immune system weaker and slowing down her body's ability to heal. Maria's doctor recommended that she increase her vitamin C intake, and soon after she started eating foods like red bell peppers, strawberries, and kiwi, while also incorporating a vitamin C supplement into her routine. Within weeks, her immune system improved, her wounds healed faster, and she felt much more energized. Vitamin C is abundant in fruits and vegetables, so it's easy to increase your intake. Some of the best sources of vitamin C include kakadu plums. These Australian fruits are one of the richest sources of vitamin C, providing over 3,000% of your daily needs in just 100 grams. Acerola cherries, another powerhouse fruit, offering about 1,600% of your daily needs per 100 grams. Red bell peppers, one of the best vegetable sources, providing around 200% of your daily vitamin C needs per 100 grams. In this video, we've explored the importance of three crucial vitamins for diabetes management: vitamin B6, vitamin E, and vitamin C. These vitamins not only help manage blood sugar levels, but also protect your nerves, boost your immune system, and promote overall well-being. Vitamin B6. As we saw in Sarah's case, a deficiency in vitamin B6 can lead to nerve damage and fatigue, making it harder to manage diabetes. Vitamin E. John's story showed us how low vitamin E levels can worsen neuropathy and leave you vulnerable to oxidative stress, but it can be corrected with the right diet and supplementation. Vitamin C. Finally, Maria's experience demonstrated how a vitamin C deficiency can impair immune function and slow healing, increasing the risk of infections and complications. If you're experiencing fatigue, nerve pain, or difficulty controlling your blood sugar, it could be a sign that you're missing these essential nutrients. Make sure to talk to your healthcare provider about incorporating these vitamins into your routine, either through food or supplements. If this video has been helpful, don't forget to hit that like button and subscribe for more health tips. Share this video with anyone who might benefit from it, and let us know in the comments if you have any questions about managing diabetes. Thanks for watching, and we'll see you in the next video.